Thank you all for joining the Emerald Medicare team and the representative from CCR, Dean. We are proud to be the trusted partner for CCR moving forward. We are recording this webinar for the benefit of all of those wonderful clients that CCR has had that are not able to participate for various challenges, including vacations. And so we're doing this today so that we can introduce the team, talk a little bit about the services that we provide, and really give everyone a sense of this transition that has occurred. As those at CCR know, Susan has moved on to retirement pastures, and we're all happy to have had her service as part of CCR. And so Dean is with us, and I have my team here, all represented and all proud to say a quick hello. But we are a 7-person team, and we've been doing Medicare for over 10 years. We have over 3,000 clients in 31 states, and we really are committed to doing what's in your best interest 100% of the time. That's what's most important to us. Our team really works together and works well together, really to make sure that we keep learning, we keep growing, we keep advancing the industry, and we keep understanding the multiple changes that are going on in this marketplace. As we approach open enrollment, there will be more of these types of webinars. But this is really designed just for the CCR clients to make a warm introduction. Many of you have received our mailings and or our constant contacts with, again, another warm introduction and welcome from us. You've also heard from CCR to sort of let you know about this transition as we move into sort of years of change and Medicare space that we're in. We are a group of people who have been doing webinars and seminars, probably about 30 or 40 a year. So our commitment to all of you to continue to keep you informed about the changes that are going on is really what I do and we do as a company. These webinars are to keep you informed, to look forward to another year of Medicare, to realize that the industry is changing. Medicare, Medicaid, the Affordable Care Act is all changing, and ultimately will have an impact. My goal here today is really to give you a sense of my team, but also to give you a sense of some of the technology that we have, some of the forms that we use, some of the ways in which we operate in our process. Probably a little bit different than the way CCR did it, but still nonetheless very much focused on customer support. And our commitment is really to communicating with all of you. And so we are a team that is here 5 days a week, 9 a.m. to soon to be 5 p.m. And we're really proud to be able to offer that kind of a full schedule as we've grown as a company. So what I want to do initially is just give Dean a few moments to say a few words, and then I will continue to turn it over to the other team members. So Dean, it's all yours for a moment.
Very kind of you. I appreciate that, Mark. I know many of you I haven't seen in a while. I became the behind-the-scenes person as Sue sort of stepped forward and took over our mission in providing Medicare services. But for those that I haven't seen in a while, I'm Dean Ada. Many of you still know me from my old days when I owned Ada Financial Group, and we did a lot of work with Erickson Insurance. I'd like to thank everybody first and foremost for that relationship we've had. And just to reassure you, it's not ending here or today. As part of CCR Wealth Management, our advisory business is flourishing, and we still remain available to everybody here if you have any financial planning, money management, or other insurance needs. So don't lose my contact information. Feel free to give me a call if there's anything you want to talk about. But as Mark alluded to, speaking of losses, yes, Sue decided to retire and spend more time with Sean, her husband, children, grandchildren. Everybody here couldn't have been happier for her, especially me, and she certainly deserves it. As you know, Sue was instrumental, again, in helping us build and maintain our Medicare services. I was lucky to have had her for 15 years, and I will tell you she was irreplaceable. But we, as CCR, as a firm, we wanted to continue what we've heard has been a valuable service, particularly given that Medicare is complex and can be quite confusing. And we believe having an agent that specializes in this field alone was worth finding for you. And so we did. And that's how we met Mark and his team at Emerald Medicare. And we think everybody is going to be in as good of hands as we were doing in the past for you. But again, if you need me, I'm still here, still available. And I'm proud to introduce or give the mic back to Mark to continue with his introductions. Thank you.
Well, thank you, Dean, and thank you for the trust from you and from your team. It's a proud day for us to have that relationship. So I'm going to start with the veteran of my team, Michelle Horton, and just to say a few words on what you do, your contributions to the Emerald Medicare team.
Hi, everyone. It's so nice to meet you. I'm so excited to be part of your customer support team. I am one of the 5 people who will help you here at Emerald Medicare. I've been here for about 6 into my 7th year here. I help daily with just regular phone calls, questions about bills. I don't understand this email I got. I don't understand this benefit on my plan. We help with pretty much anything. We'd rather you come to us before you go to the insurance company because we are a bit more helpful and we're able to help in the back end where you wouldn't have as much luck at the insurance company. And I love working here and I love everybody that I work with. We have fun every day and we love what we do here every single day. So we're very excited to have you on board.
Thank you, Michelle, and always understating the value that you bring. So thank you so much for all you do. You have helped me grow this business in immeasurable ways. I'm going to go next to Diane. If you could say a few words, that would be wonderful.
Hi, everybody. So nice to meet you all. I'm Diane. I work in the support staff as well. I've been here just under 2 years. And I work with Michelle, Kerry, Matt, and now Chris, doing everything. I answer the phone. So if you call into us, you'll most likely get me on the phone. I'm here to help with any questions that you have. I do all of your medications and doctor lookups to make sure that we're giving you the right plans for the following year. And then I will process your application. So you'll be in touch with me for a long portion of, whatever needs you have from the beginning to the end. And I also help Mark with his daily scheduling and setting up appointments, things like that. So it's really nice to meet you. Welcome. You're in good hands with the Emerald team. We're all here and we are always here to assist you. So welcome.
Great. Next up, Carrie.
I'm Carrie. I do a lot of the same stuff as the other members of the team in fires of support and everything. Something different I handle is any dental questions or issues. If you want to look up any plans, I'm here to help with that. Any vision, hearing, kind of all pairs together. I also go out to medical offices around the area and introduce ourselves, let everybody know who we are. We're local, we're here to help everybody. That's it. I've been here almost 5 years and it's been fabulous. Couldn't be in better hands, like everybody said.
Thank you, Carrie. We'll go to Matt for a moment.
Sure. Yeah, hi everybody. It's so nice to meet you. I'm Matt. I'm Matt Civitano. I've been a part of the Emerald Medicare team now for almost 3 years. I do a lot of our marketing efforts here, so constant contact messages, website management. We coordinate with different partners and different vendors, people who do different marketing work with us. And I get to be creative too, and I get to do a lot of graphic design work and work on flyers and some of our marketing materials. Yeah, and outside of that, I support the team in whatever ways I can, some IT assistance here and there, some technical help. I started doing client service and my role kind of grew and it's been very rewarding to be a part of a team that is this passionate about what we do. We all really care very much. Like Michelle said, we have an awesome time coming to work today, every day rather, and learning with each other. We really do learn something new about the industry every day. It's always changing. But yeah, we really do have an awesome team here that cares a lot about the work we do for our clients and doing it the right way. So it's a pleasure to meet all of you, pleasure to have you all on board and part of the Emerald Medicare family.
Great. Thank you, Matt. And our newest entrance is Chris. So Chris, say a few words, and he's starting on board on the 18th. So just say a quick hello, Chris.
Hello, everybody. So yes, my name is Chris. I'm the newest member of the team. I'm very proud to say that I'm going to be starting my first day on the 18th with Emerald, and I definitely look forward to working with everyone. So.
Well, thank you. So we have one other person who's actually starting mid-September as we approach open enrollment. We know that the phones ring off the hook, and our goal is to really answer the calls as quickly as possible. We understand the frustration that people have when it comes to moving things forward in a very short open enrollment period. So we have a receptionist starting. Her name is Linda, and she'll also be on board, and she's a great addition to the team. So we're a team of 7. We support over, again, 3,000 clients, and it's a great industry. It's an industry where we find that people are so grateful for the work that we do. Of course, we work off of referrals, and so we get a lot of referrals. We work with financial planners, clearly, CPAs. We work with case managers. We work with social workers. We work with veterans. We work with people in human resources. And as Kerry alluded to, we work with medical offices who often have clients and patients who really don't understand Medicare. We try to educate medical office personnel because, quite honestly, they need to understand more about Medicare. I'm always amazed on how little they actually do know. If you do have any questions while we're going through this, please don't hesitate to use the chat feature. But what I wanted to do at this point is just go through a small presentation. I want to give you a sense of the education that I provide on a regular basis. Again, I do about 30 or so of these a year. I often speak in front of groups of 50 and 100, but also small groups, meet with people on Zoom, meet with people in my office, and a lot of phone calls. So a lot of what you'll see as we go through this presentation, but also the process of understanding Emerald Medicare, is our goal is to have you get the best help from the right resource on our team. Some of you will wind up talking to me, and some of you will talk to Michelle or Diane or Carrie. I feel so proud on how well they've been trained, and they are so capable to handle so many of your questions. But when the need comes up, I'm happy to be a resource. I'm happy to be there. And of course, I'm always happy to educate people. So I'm just going to go through a small presentation here, and hopefully this will be of some value to all of you. And again, this is being recorded so that others can also listen to it. But again, we welcome the team. We are independent, which means, and it's important to CCR, it's important to the industry, is that we are loyal to no carrier. We are always going to do what's in your best interest 100% of the time. There are many people that we work with that are on a school district plan, a company plan in retirement, and we will always recommend the right thing based on their health and their budget. But the Medicare basics, I'm going to go over a little bit. A lot of you understand Medicare basics. I think I'll bring some new information to the table, which is what I always do. The doctor runs and the prescription drug runs. These are the core to making changes during open enrollment. We are actually implementing artificial intelligence. We have a scope of appointment. We have a consent form. We have the processes in place to be efficient in the work that we do. We've been doing it manually for so long, so many years. And the prescription drug runs are really important to everyone. And so we're really looking to find a way to become even more efficient with that. But some of this information is not necessarily being transferred over by CCR, may not be able to be. And so many of you will just need to provide us with updated doctors and updated meds so that we can actually do the work on your behalf. There's a lot of things changing in Medicare. Again, I go to large conferences with other Medicare professionals, and I'm always trying to know more so that I can educate my team and educate my clients. You will see over the next few months, I will have a number of webinars that are going to be set up so that I can continue to educate you pre-open enrollment, but also educating you, your friends, your colleagues on Medicare in general. We're using something called RX Care and Aiden, which is a virtual assistant. It's really exciting. It's state of the art, and it really gives us a chance to help you with medication savings. Also to be more efficient in the work that we do and being able to support you, not necessarily waiting for information from us that you can actually use what we feel is a benefit of AI that's changing the Medicare industry, but also how to reach us. Not only our phone number, but also our hours that I mentioned earlier. So again, just going to go through this presentation, and I hope it's of some value. Just real quickly, I've been in the healthcare industry for 30 plus years, 10 years as principal of Emerald Medicare. But my value to advisors, and not just financial advisors, but CPAs and case managers, people who work with seniors, is that we have an expertise that people really value. I was the president of my local financial planning association for many years. I'm still very active in the group because I do believe that financial planners really have a real need to provide this kind of service for their clients. And again, proud to be connected to CCR. I'm a major speaker and sponsor for the Massachusetts CPA, for Connecticut CPA, for FPA, and for case managers nationally for social workers. I've provided learning for over 4,000 seniors and over 2,000 trusted advisors, and I just love doing it. It's really what juices me up, is to get up in front of a room full of people and educate them and really answer their questions. For those of you who stick around to the end, we certainly will answer questions as well. But I'm also the sole independent resource for our local healthcare system. So that's one of the reasons why Carrie goes around and talks to the medical offices, because we are so entrenched in our community and communities that we surround. But I am, as Dean and Susan has been, I'm very active in my community. I'm on multiple boards. I've been on the radio shows locally. And it's really important for me not only to give back, but also to educate as many people as possible. So people shout from the rooftops about questions, curiosity about Medicare. Do I have to get A? What's the timing for B? Most of you are on Medicare, but there are plenty of people out there who, one, are confused. We get calls every day with misinformation. Does it cover eyeglasses? Does it cover home care? What are these penalties that are out there? So, we know the frequently asked questions, and we're really here to help. But just a brief history of Medicare. I always think this is interesting. Harry Truman sort of introduced national health insurance for Americans, and Dwight Eisenhower and Kennedy thought that these were engaged voters. We need to help them out. And in '65, Lyndon Johnson did sign into law Medicare Part A and Part B, which is still today. Part A being hospital, Part B being outpatient coverage of all sorts. But it was '70s through the '90s, a combination of presidents, where Part C, for choice, which is these Med Advantage plans that really allowed Americans to have a managed care plan, low premium plans. There's bias one way or the other, but more and more with the changes in the premium increases going on with Medigap plans, people are actually looking more at these Advantage plans than ever before. George W. Bush put into place Part D, which is prescription drugs. Lots of changes in 2025 that have occurred, and I'll cover that later. But healthcare costs are really important. Anybody who's working with a financial planner, hopefully you all are, you all know that healthcare costs are part of the presentation, a part of the analysis. And healthcare costs include premiums and copays and deductibles, and of course, prescription costs. So drug costs are important, but also dental. We see that all the time. As people turn 65, all of a sudden, they may not have taken advantage of some of the dental coverages that they had, but now they know that in some cases, they really want to make sure they have some dental coverage. So just a couple of interesting statistics that I wanted to share is that the average cost for healthcare in America is around $11,000 per year per person. $4.5 trillion is spent on healthcare in the United States, eclipsing the gross domestic product of many third world countries. Is it efficient? Not necessarily, but that is a lot of money being spent. 50% of all medical costs in America are pre-diabetic and insulin care or medications surrounding that. It's a huge component. These insurance companies are doing everything they can to, one, lower the costs, and two, keep people healthy. Poverty and racism account for about 60% of all healthcare costs in America. 63% of people aged 65 and above consider healthcare to be their number one concern. People are concerned about getting this decision wrong, which is why it's really important to work with a broker who's independent. A couple of trends I just want to point out is one is that 24% of Medicare beneficiaries use Medicare.gov. We truly encourage people to go onto Medicare.gov. And the reason why is that your medications that are prescribed by your doctor, when they get prescribed, they get automatically uploaded into Medicare.gov. If you sign on to Medicare.gov, which we absolutely have the ability and the desire to have you do that, we will be able to help you even further with not just Medicare pricing going into open enrollment, but throughout the year as additional medications are added to your list, we may be able to help you find some savings. 30% of all Medicare clients are hospitalized to some extent each year, but the carriers really want to avoid these hospitalizations. It's their largest expense. So these managed care companies, all the companies are trying to have home visits so that they really do understand their client better and they reduce hospitalizations. About 2.5 million Medicare enrollees actually pass away each year. And on the Advantage side, which again, there's a lot of bias one way or the other, but they work for many, many people in many parts of the country. There are, 74% of the plans around the country are zero premium plans. They still have copays, they still have deductibles. But some of the things that are changing is that the plan designs, even by $5, is going to impact their customers. And so these are the kinds of changes that happen every year, and we're constantly in touch with them. 80% of people who enroll in Medicare really do it on their own. We want people to get broker support, an independent broker. And again, people worry about making this decision and doing it wrong. Social Security goes up over the last 30 years, 2.3%, but Medicare Part B has gone up 5% over the last 30 years. So it's not always talked about the Part B premiums, but certainly Social Security increases are always very much in the news. But there have been notable Medicare changes over the last couple of years. One of them, and I alluded to them a few moments ago, is about the insulin cost cap. The cost cap is for insulin on almost all medications relating to insulin is $35 a month. And this is essential for so many people who have some sort of diabetic illness. And that really has helped people save a tremendous amount of money. The recommended vaccines, again, a lot of the out-of-pocket costs for the vaccines that are recommended, shingles and pneumonia vaccines are now covered under Part D coverage when previously they weren't. In 2024, expanding of the Part D extra help program, which sort of raised the resource and income limits so that more people can qualify and get more discounts on prescription drugs. And that is where in 2024, the negotiation of drug prices really began to take impact. 10 medications in 2025 were negotiated. more in 2026. We have not seen the list yet, but more are coming. And our hope is that it's a very large list because so many people are impacted so much by this. But Medicare is at its crossroads. I think we can all sort of know this, is that the current administration is rescinding some of the Affordable Care Act enrollment periods and funding for assistance, some of these subsidies. But, under the Affordable Care Act, enrollment doubled, people were covered, there was no pre-existing conditions. So the future impact is truly uncertain. And the drug pricing reform. The current administration is rolling back potentially some of the last administration's policies to curb drug costs. It's sort of, is it stalling or is it accelerating? I don't know. What I do know is that medications like Ozempic and Wegovy that are so popular nationally, they're not necessarily on the list, but they are medications that even if it's not just for weight loss, things like cardiac and sleep apnea are actually beginning to allow Ozempic and Wegovy to be approved. And some of the grants that are being frozen for so many hospitals. My understanding is that there are 11 hospitals in New York State that may close due to reduced funding. So there's a lot of challenges that are going on right now with reducing funding because a lot of these rural hospitals really do depend on Medicaid. So health insurance is different for everyone. Those of you on the call are probably on Medicare, but many people are not. And it's really about what does your retirement coverage look like? Are you being offered something or not as part of your retirement? Because we take the time to look at the group plan that you're being offered and see if it's better for Medicare or not. Often you get a retirement package, and if you don't take it, you can never get it back. So it's really important to review that. But it's really important to look at the premium costs for the employee, for the spouse, for any children that may be on it, to look at COBRA, to look at the savings. I get a lot of calls with people who are going on to COBRA. If you're going on to COBRA and you're over 65, you have to have Part A and Part B. There are a lot of mistakes that are made in that arena. But everything about Medicare is about current utilization, health, and budget. So people who have come from another plan of some sort from their company or even a plan within Medicare, you're always looking at what are the copays, deductibles, and out-of-pocket maximums. And that's really what we look at to make sure that we're doing what's in your best interest. But the transition from retirement over to Medicare is so very important. And people get really anxious and nervous about it. We've heard the questions, we understand. We're kind, we're sympathetic, we're compassionate, and we really do want to understand all the facts before we make any kind of a recommendation. But offerings of these plans do vary by state and sometimes even by county. So each year, we really encourage people to evaluate their plan, make sure it's the best fit for them. Some of you will simply stay the course with what you have. It could be a supplemental plan, it could be a prescription drug plan, and it could be a med supplement plan. And that's 50% of the people do stay the course, but they might want a little bit of insight. We're encouraging people to email us, ask your questions. We'll get back to everybody because we always do. Part A is hospitalization. Part B is all of the outpatient services, the durable medical equipment, all of the doctors, the specialists, preventative services, all of that is Part B. Part A is free, Part B is not free. But original Medicare doesn't cover everything. Some of the Advantage plans cover some of the things that are listed here. Dental care, some of the acupuncture, hearing aids, some of the, depending on the nursing home care that one wants. These are things that original Medicare doesn't cover, which is why you either add an Advantage plan that covers some of these or a supplemental plan, which often doesn't, but one has to supplement it, the 80% of Medicare in some way. The enrollment periods you're all familiar with. You are familiar with annual enrollment. That's October 15th to December 7th. We're going to be doing webinars, and you're going to have a chance to speak to us and share the information with you, with us. The initial enrollment period is really for those people who are turning 65, who are working for a company of under 20 employees, unemployed or self-employed. But most people get nervous around this time frame, and many of them just get Part A. And so getting Part A is fine. It's premium free. It's hospitalization only. They can put that Part A card probably in their desk drawer. But it's really, if they're working for a company of 20 employees, they can get Part A, but Part B has a cost. And that's where we really, really advise people and understand their situation. The open enrollment period is a very unique time. For folks who are on an Advantage plan, they have those 3 months to still change to another Advantage plan if it's not working for them. They also have the chance to change from an Advantage plan to original Medicare and a supplement. You can't change your prescription drug plan yet, but this open enrollment period does give people another option, another back door to be able to make a change. For those people who are losing their employer group coverage, the special enrollment period is what takes place. At least half of our clients are just losing their employer group coverage. Half of them is turning 65. And so that's the work that we do. But if people are moving out of the state or the county, we need to know about it, because even as simple as the prescription drug plan needs to be changed within approximately 60 days of moving to a new area permanently. The income adjustment, some of you may be already feeling the impact of this, but this income adjustment applies to those who are single and married filing separately. But the baseline for Part B is $185 a month. If your income, your adjusted gross income from 2 years prior is less than 106 or less than 212. If it's above that, you have an income adjustment you can see on Part B and Part D. So people who are retired are often making, decent money, decent income, and based on retired minimum distributions and other sources of income, they could be in a higher bracket. So people are very surprised by this, but there is good news. The good news is that there's what's called a life-changing event form. This form allows you, if you have one of those 8 categories of life-changing event, to be able to actually reduce your income-related adjustment from the government to a lower number. So it's basically asking you to estimate your current year, or maybe 2026's income, and get the income-related Medicare adjustment reduced. So if you are able to lower it even 1 bracket or 2 brackets based on retirement, based on not getting the same kind of income, you have the opportunity to fill this out. We have helped hundreds and hundreds of people with this, and they are so grateful, because you can see from this chart that the amount of money that it goes up to for either single or married people is quite high. And people do love the fact that they can actually save this kind of money by filling out this form. But when it comes to Medicare, there's really 4 choices. You either stay with your employer group plan, you stay on original Medicare, which is risky because you're at risk for 20% of all charges, and there's no prescription drug plan added to that. Med Advantage plans work really well. And so the folks on this call very likely could be from a few states that I'll mention: Connecticut, New York, Massachusetts. Those are 3 great states where if you're on an Advantage plan and you're on it for a couple of years, you're saving thousands of dollars a year, and it's working fine for you, and all of a sudden things change for you, you can move over to a Medigap plan, a supplement plan, without any health questions, underwriting, or pre-existing conditions. The only other state that it includes is Maine. And so those 4 states actually, really gives people an opportunity to test out or utilize the Advantage plan, again, as long as their doctors are in their network. The supplemental plan are more expensive, but they cover basically 95% of all doctors in America take Medicare. So those plans are much more comprehensive and higher price, and it does not include a prescription drug plan. The Advantage plans do include a prescription drug plan and some other benefits like dental, maybe some hearing aids, maybe some over the counter. And so these are the decisions that people need to make. But our process, and a couple of my staff alluded to this, we do this work every single day for people who are looking at an Advantage plan. Because on the Medigap side, again, 95% of all doctors take Medicare. But on the Advantage plan, we have to be pretty clear on which carriers that we can recommend to you. So we get a list of your doctors. We actually have something called a Pearl that you can actually enter in your doctors and meds online. But we also have a fillable form that we have. So our technology is really advancing to make your lives easier, to make us more efficient, and be able to manage the clients that we have. But there's nothing more important to clients than the prescription drug side. It has changed a lot in 2025. Clients have a real sensitivity to these expenses. The annual deductible is $590 in 2025. That's up from previous years, but that deductible only applies for brand named medications. And so that's one early year expense that many people have. But there are these stages. There's deductible, there's the after deductible. But the biggest change in the industry is that the maximum out of pocket for prescription drugs for 2025, not including the premium, is $2,000. That's down from $8,000 in 2024 and has truly transformed the industry because of this one statement. Premiums on Medigap plans have gone up. Benefits on Med Advantage plans have gone down. And the impact is being seen. Last year, there were a lot of Advantage plans that went away. We had to help people find a new plan. A lot of the prescription drug plans changed the formularies, but $2,000 maximum is a great benefit to so many people. It's going up to $2,100 in 2026, so not a tremendous increase. But each carrier, each plan within each carrier has a different formulary and there's different tiers. So these prices change yearly, folks. And we really encourage everyone to review their prescription drug plans. Again, getting your meds is important, whether you do it online or through the form. We really want to see what they are and help you through this process. But there are preferred pharmacies and standard pharmacies, and they price out differently. But we also have other options for discounts. And I want to get to that in a moment more extensively, but some of you know of GoodRx. They've actually changed their model recently that in order to use GoodRx, you have to actually give them your email address. And that email address is actually going to a Medicare agency. So that has been a big disappointment because GoodRx is sort of a household utilization. We've been using Needy Meds as our go-to for these discount plans, but there's also international pharmacies and there's also pharmaceutical grants. So here's just an example of a prescription drug run. Again, this is through Medicare.gov. Again, we encourage people to sign up for Medicare.gov because it'll help us and help you. But you can see that based on the pharmacy and based on the meds, the 3 meds that are here, the premiums are different and the cost of the meds are different as well. So this is the kind of information that we provide and that we work on every single day. But there are other pricing resources, and it is our commitment to our clients because of how important prescription drugs are, is to help them find the best pricing. This Canadian store is actually out of Florida. They have some real competitive pricing. Needy Meds is actually a nonprofit, which is why we like them these days. Amazon and Cost Plus have generic meds, so it doesn't always pay to actually go on that versus your regular prescription drug plan. But this is one of the most amazing things I can show you today, and that is that when we run your prescription drugs, we are actually showing you the retail cost. We're showing you other options for other discounts. You can see that a medication that might cost a one price. Again, there's so many different options we could have put in there, but you can save on international pharmacies, needy meds, pharmaceutical assistance programs, and we also look at your current coverage on what it's costing for you. So this is a brand new technology that we are not just piloting, but we're really, in a way, the first in the industry to be implementing this. And again, it's all for your best interest so that we can help you save the cost of medications as needed. Dental. People ask about dental. They haven't used dental. 77% of the people who of adults say they're going to go to the dentist, and only 37% do. Coverage varies a lot. It's either critical or non-essential. It is so important to be healthy, to have oral health. There's a lot of things that are impacted by poor oral health. Dentists can often detect diabetes, cancer, heart disease, and dementia early. But the interesting statistics here, folks, is that 1 in 6 adults over 65 have untreated tooth decay. 2/3 have gum disease. 1 in 5 adults have delayed or skipped dental care in the last 2 years. 47% of adults have dental coverage. That's it. ER visits that are preventable have surged. And many states actually have excess dental capacity. So if you look at the right side of the screen, this is where a lot of the services that people often speak of, that they feel like they get no help from their dental coverage. The truth is this major comprehensive work on the right side of the screen is really those comprehensive services that are covered at 50%. The services on the preventive side are often free. The basic services are covered at 20%. But it's the people have to realize that whatever plan they have on the major comprehensive services, it's only covered at 50%. The other thing I want to mention here is a part of the work that we do and all the connections that we've made in this industry and all of the senior groups that I belong to is that there are other resources that we have access to. Whether it be legal, you have your financial planner, but there's mediation, there's senior living options. There are so many different areas of senior care, and we have a resource list. We have people around the country who can truly provide these services, and we get asked these questions because we're a trusted advisor. A couple of additional things, and again, I think I'm still on track here. Alzheimer's patients, more and more work is being done to support them. But Medicare will cover home safety evaluations. They'll cover cognitive assessments, care planning, and of course, prescription drugs. But one thing that's very exciting is there's a new program called GUIDE. And this is really an integrated plan that's just delivered in 2025, that it's a comprehensive plan that includes caregiver support, respite for those people who are helping the person on dementia, and it's a coordination. It's community-based and it's accessible 24/7. So this is a new program that, again, I'm speaking about because I talk to people in the Alzheimer's Association. We're all trying to make sure that people on Alzheimer's understand that this program does exist. The other area that is often neglected is hearing. People often wait too long to address hearing needs. A lot of loneliness and isolation and depression could come from not having the right hearing aid or even identifying that hearing is an issue. It increases the risk of falls by 50%, but 37 million people in America have some level of hearing loss. 26 million more struggle with listening despite regular testing. We have been very serious about this topic. We've recently, I think, did a constant contact to everybody about it. We have some vetted audiologists, not just an ENT company, but audiologists that really understand how to do the proper testing. But there's a misconception about hearing aids out there. 63% of millennials consider it to be a sign of aging or weakness. 47% of Gen X and 41% of boomers. People wear contacts People wear hearing aids and they get bias against them. People have Invisalign, but hearing aids should be seen as normal and not shameful. Coverage for diabetic medications with weight loss benefits. So these medications, I alluded to it earlier, Ozempic and Mounjaro, they are now being included for things like sleep apnea, and for other chronic conditions like cardiovascular. The doctor has to cooperate. The doctor has to be able to submit documentation around that. But I've talked to some cardiologists that are actually beginning to get some of these medications approved. They're very expensive, and that's an important change. Also, mental health. Mental health providers are being added to the Medicare rolls. They're looking to add 400,000 clinicians nationwide that are eligible to serve Medicare beneficiaries. So many times people ask me, is my therapist covered? And in almost all cases, the answer is no. And so they're really trying to add a whole large number of them. And, it's especially important post-COVID, certainly in rural areas. Aiden, this is the area where we have an AI assistant that we've trained that is smarter than us, but we have trained it to raise the bar for us, to simplify drug plan comparisons using what I mentioned a few times, the Medicare.gov integration. It helps us identify those cost savings opportunities that I mentioned in a few screens before that throughout the year. It tracks your medications and then flags those important coverage changes automatically for us. So we're doing everything we can to support you on the medication side. It allows our team to deliver faster, more accurate support without all the extra paperwork that you have to go through in order to change your plans. And it adds a new layer of personalization and precision, because the prescription drug plans that are available on Medicare.gov is where we go and is the information that you as well want. So how do you prepare for coming into the 2026 season? I can tell you chaos is what we experienced in 2025. We work countless hours, 7 days a week, and my staff and I are determined to support everybody, but also to make sure that we handle all of you in a time frame that meets your needs as well. So there are some action steps. The action steps include what you're familiar with already: a scope of appointment, a consent to contact. We'd like you to do Blue Button. The one other thing I mentioned is something called a Pearl that allows you to enter your doctors and meds online. But there are changes that are coming. Because of the Inflation Reduction Act of 2025, the changes because of the prescription drug maximum of $2,000. Every carrier has reevaluated their pricing on everything with Medicare. It's hard to explain in this type of a webinar, but we have seen a tremendous impact, and last season was really chaos. And coming into this year, we are not yet ready to speak of what the changes will be because we don't find out until October 1st. So this webinar is about letting you know what we do and what we're gearing up for. As a team, we met today really to strategize around all the things we need to put in place for open enrollment. But we want you to do the SOAs, the scope of appointments, the consent, the Blue Button, to make our lives and your life easier. You will actually be getting an email from RX Care, not from Emerald Medicare. So be on the lookout for that. But this is the way we can review your coverage and advise you whether a plan change needs to be made. So changes for 2025. Part B premium went up, Part D deductible went up, Part B deductible went up, and the maximum out of pocket for Med Advantage plans went up. And they will go up again in 2026. And we will let you know what those are. But we really believe strongly that one needs to recognize the importance of knowing your plan potential costs. You don't have a crystal ball, On the other hand, when something does come up, you want to know what those potential costs are the best you can. And it's also, the importance of integration of your healthcare costs and financial planning. The fact that CCR had such a focus in on Medicare as part of their financial planning process is something that I think is really noteworthy because not all financial planning outfits do that. And it is a key component to be able to support clients in the financial planning model to integrate healthcare costs. We speak all the time about advocating and appealing. It's in capital letters. People often don't advocate and appeal charges. Michelle, who has got great experience in billing issues, often bills are not correct. There's fraud out there and there's abuse. And so paying a bill right away isn't necessarily the right answer. But we know that for the people who appeal, 80% are actually successful. It might take a few times, and sometimes it's hard to find an advocate, but it is important. Seek objective information. That's what we're providing here as a team. That's why CCR has chosen us. We're objective, we're independent, we're going to always do what's in your best interest. Discuss this during AEP. Again, you have friends who are turning 65, but during the open enrollment, this is the season that one looks at their plans and makes a decision to either stay the course or move to another plan. But before retirement, that's really what people are really getting ready to think about. What's my healthcare needs going to be? The decisions are around 65 and retirement, but evaluate the doctors and the medications. Consider the chronic conditions or any special health needs that people have, and really understand the advantage of Advantage plans or the advantage of Medigap plans. They both have their benefits, and we always try to explain to people who are interested in both options. Medicaid is one of the areas that's changing a lot because people on Medicaid and Medicare have access to something called a dual special needs plan, which actually offers additional benefits. So we certainly support clients in all income brackets. And that's one of the ways in which we do that. But Emerald Medicare proudly is your trusted resource, and we look forward to being that for years to come. So you can expect support from us in many ways. We're expert guidance in education. I'm all about education. That's why I gave you this extra piece of education, because I want you to understand that it's not just about your plan and your doctors and your meds. This is about an industry that's changing, and knowing that you have friends and you have colleagues who want to know that there are people out there who have unbiased, objective information. I do in person. I do churches. I do senior centers. I do associations. Again, I love speaking about this topic, and I can talk for hours. But virtual education works too, and you'll see many opportunities through the year. We have, as I've spoken, cutting edge technology to really optimize the services that we provide and offer savings in any area that we actually are working through your Medicare. The annual review, there's an ANOC, which is an annual notice of change that you all get in the mail. Many people don't really read it or don't notice the subtle changes, but that annual notice of change will really bring to you from the carrier itself the changes in your plan for the new year. We want you to access our friendly, experienced, and knowledgeable team. And most importantly, our services are absolutely no cost at any time. We get paid by the insurance company. We do a lot of work that for many people, we're just guiding them and helping them feel confident in the decision they've made. And we only just ask that they tell a friend. So this is our team. We don't have Chris in here yet. We don't have Linda in here yet, but this is our team. And I want to thank you all, and I can open up the questions. Dean, do you have any comments now that you've heard this presentation to your fine friends and clients?
No, I think you said everything very well, and I will emphasize there is not a difference if you try doing this yourself in terms of your cost. So you're gaining expertise and a friendly person on the other side, like what Sue and I tried to provide over these past 15 years together. take advantage of it.
Thank you, Dean. I want to thank everybody, and especially Dean and CCR for the opportunity to service your clients. I will see you soon. And again, I look forward to a connection that lasts years with a team that's growing and an industry that's changing. So thank you again, and thank you all for participating. And thank you, my staff, for being on this call as well. Thank you all.
Thank you, guys.
Good night to all. Bye now.